The Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana (PMBJP) is a Government of India scheme designed to provide quality medicines to the masses at affordable prices. Under the scheme, Jan Aushadhi centers are set up in various parts of the country, allowing people to purchase generic drugs at reduced rates. Initially launched by the UPA government in 2008 and subsequently relaunched by Prime Minister Narendra Modi in 2015, these stores have been a significant source of relief for low-income families seeking affordable medical care.
डॉक्टर ने तो लिख के दिया कि ये दवा चाहिए, जैसे इस्टामिट 50/500 या 1000। अब ये मुझे खरीदना है, मैं जहाँ से खरीदूँ।
हाँ जी।
मुझे खरीदना है तो पहले हम अपोलो वगैरह से खरीदते थे, अपोलो से कोई और स्टोर से। अब ये दुकान खुली तो यहाँ से खरीद रहे हैं। तो यहाँ पे पहले ग्लाइकोमेट मिलता था डायबिटीज का, ये नहीं था। अभी कुछ दिनों से मिलने लगा है ये इस्टामेट। तो प्राइस का काफ़ी डिफरेंस है ना जनरल स्टोर से और यहाँ से। जैसे मान लीजिए इस्टामेट 220 रुपये का मिलता था, यहाँ 65 का मिलता है। ग्लाइकोमेट 46-47 का था, यहाँ 10 रुपये का मिलता है। तो ये काफ़ी रिलीफ है, सबके लिए है, सब लोग आते हैं। बट बेसिकली जो रिटायर्ड लोग हैं या जिनकी इनकम की प्रॉब्लम है उनके लिए ये बहुत अच्छा है। मंथली बिल काफ़ी कम जाता है।
However, not all is well with these Jan Aushadhi centers. A nexus between doctors and pharmaceutical companies ensures that generic medicines are not prescribed to patients, while another nexus between Jan Aushadhi stores and pharma companies results in the unlawful presence of branded medicines in these government stores. Moreover, the stocks of generic medicines are consistently in short supply, and ultimately, the common man pays the price for these unethical practices.
This scheme has umpteen limitations. In fact, its reach to the people is almost negligible. Hardly people are aware about a scheme of this kind. Secondly, doctors don't support this scheme at all. Doctors prefer to write medicines by their brand names. So these medicines, if prescribed by brand names, will not be made available, will not become available. And then the number of outlets under this scheme are too little, too few. And that too, they are like in district where I live in Chittorgarh, there is only one JSK in the entire district. So medicines are something which need to be available, which are required to be available as close to the hospital or as close to the house of the patient as possible. And then the medicines, the number of medicines which they have put into now, as I was looking at their website, I found that they now have 1800 medicines and some 200 and odd surgical medical devices. So far as medical devices are concerned, it's fine. But how could they have so many medicines? Because in the essential drug list, in the drugs which are essential, it's only about 375 drugs. So at best, with 375, you could have around 400 to 500 or at best 600 drugs, not more than this. It means not only they are stocking generic medicines, they perhaps are also stocking medicines which are not generic. They are combination drugs.
We spoke to Shalini Sharma, a shopkeeper at a Jan Aushadhi store in Ghaziabad. We found a lot of branded medicines at her Jan Aushadhi outlet. First, Shalini spoke to us about medicines and salt names.
जो जन औषधि की दवाइयाँ हैं उन पर सब पर जन औषधि का चिन्ह है। भारतीय प्रधानमंत्री जन औषधि करके जो ये लोगो लगा हुआ है, ये सब मेडिसिन पर है। तो वो और जो भी मेडिसिन लेकर के आते हैं उनकी मेडिसिन पर सॉल्ट नेम लिखा होता है। तो बेसिकली जो जन औषधि प्रधानमंत्री जी मेडिसिन दे रहे हैं वो सॉल्ट नेम से दे रहे हैं। तो आप कोई सी भी ब्रांड नेम की दवाई लेकर के आइए, हमारे यहाँ से उसका सॉल्ट नेम मिलता है और सॉल्ट नेम बहुत सस्ता होता है। सॉल्ट नेम से जो दवाइयाँ मिलती है वो बहुत सस्ती होती है।
And then she spills the beans on the low supplies of medicines and confesses that branded medicines are kept at her store as an alternative to compensate for the government's inadequate supply.
कुछ मेडिसिन ऐसी है जो आउट ऑफ स्टॉक हो जा रही है, जैसे कि शुगर की कुछ इंसुलिन वगैरह हैं। अभी एक इंसुलिन है, ड्रग कोड है उसका 920, तो वो आ रही है, कभी नहीं आ रही है, उससे काफ़ी सारी दिक्कतें हो रही हैं। और एक इंसुलिन और है 143 उसका ड्रग कोड है, वो तो पिछले 2 मंथ से नहीं है हमारे पास में।
तो डाबर पुदीनहरा टैबलेट भी एंटासिड है शायद।
हाँ जी, वो भी है हमारे पास।
उसके अलावा भी कई ब्रांडेड प्रोडक्ट्स और जो दूसरे ब्रांड्स के हैं जेनेरिक के अलावा, वो मैं देख पा रहा हूँ मेडिकल इक्विपमेंट में भी एक्यूश्योर करके किसी कंपनी की बीपी मशीन या कुछ है।
और हमारे कुछ रेगुलर कस्टमर हैं जिनको बाहर से बहुत महंगी पड़ती है, तो कोशिश थोड़ी बहुत यही रहती है कि उनको हम कम रेटों में यहाँ से भी कुछ उपलब्ध करा सकें।
The Government of India recently announced the establishment of an additional 10,000 Jan Aushadhi centers across the country by the year end. However, it has been over 15 years since the scheme's inception, and successive governments have failed to fulfill any of the initial promises made.
You see, I still remember in December 2008, Honorable Minister Ramvilas Paswan launched the first store from Sastri Bhavan. And I still recall, because I was involved right from day one in handling the call center in terms of 1800-180-8080, which we started. And we used to manage it. We, matlab, the consumer organizations or the patients organization is to manage it. And the Honorable Prime Minister gave a huge direction to this store. And he promised that he would open more than 1.5 lakh stores in the country. You know, today we have reached around 9,303 stores spread all over the country. We need to expand that much more, where citizens can get generic medicines of high quality at a much affordable price than what they are paying today. As you know, there are about 1,800 medicines to be sold out of these stores and 285 surgical, products to be sold from Jan Aushadhi stores. But most of the time, when you visit these stores, you don't even find 20-25% of the medicines available.
Apart from the other issues, the sale of branded medicines in these government centers appears to be the most critical problem.
Another problem is that it is illegal for the Jan Aushadhi Kendra owners to sell other branded products and other branded medicines. But it is very common from their end that they do this practice. They give a logic behind this, that when the stock is not coming from the government's end, then we have to keep something or the other to give to the patients. Put some light on this issue.
Yes, that is why I am right from the beginning trying to convince the government that the Jan Aushadhi stores must have the 1,800 drugs and 285 surgical products made available at every point of time. It should not run out of stock. Because if you want an entrepreneur to be making profit out of his investment, you have to ensure that you give enough stocks. And that is what is the motive behind it. We want qualified pharmacists to start Jan Aushadhi stores and not have bogus certificates displayed in the retail counters, because we want to make sure that all Jan Aushadhi stores are managed by qualified pharmacists. And qualified pharmacists are in short supply in our country.
The entire public healthcare system in India has been overtaken by private pharmaceutical companies. The collusion between private players and government departments often leaves the common man struggling to access affordable and quality healthcare services.
We live in a country, as we all know, India has great manufacturing capacity of medicines. We are known as the pharmacy of the world. So because I think more than 200 countries, they rely on us when it comes to the supplies of medicines. Having said that, unfortunately, according to WHO, the World Health Organization, less than 30% of our population actually have regular access to essential medicines. And if you look at the recent NSS survey, the National Sample Survey, which is conducted by the Ministry of Statistics and Program Implementation, the survey results show that overall across India, public health facilities account for, a negligible 30% of the overall healthcare services, and which have implications, which means 70% of the healthcare services are being provided by the private sector.
Dr. Ghosh reveals startling details about a survey conducted by his organization on the availability of Jan Aushadhi medicines.
We chose 2 districts from Maharashtra, 2 different settings. One is Mumbai, as you can understand. We also selected another district, which is 100 odd kilometers away from Mumbai. It's called Palghar. So, essentially it's an agrarian setting, largely rural, and also inhabited by the tribal population. So it's a tribal dominated district. So that was the rationale. We wanted to understand what's the situation on the ground in the urban setting as well as in the rural setting. And the findings are quite startling in a sense. Overall, we found that the availability of the medicines which are supposed to be available at PMBJP stores, the availability was around 50%.
One of the problems with this PMBJK is the supply chain. So if the supply chain is not there, then what happens is, suppose there's a diabetic patient who comes to me regularly, and then I say, oh, this medicine is not available. So, or hypertension patient, this is really very difficult to convince that you please take this alternate for a few days. And we don't know when we get the next drug. And second, also quality testing is there, I know, but it needs to be more robust and it needs to be made transparent. Otherwise, consumers will not have confidence on these medicines.
The Jan Aushadhi scheme is undoubtedly a novel scheme, but it lacks in its implementation. Experts suggest that healthcare has become such a critical aspect of our country today that the government should consider making not only affordable medical care available, but also ensuring access to free medical care for people, particularly for the poorest of the poor.
The point is that you have to make medicines affordable. If you want to make medicines affordable, then there is no option but to go for generic medicines.
Sorry to interrupt, sir, but why not make medicines free like Tamil Nadu and Rajasthan have done, instead of making them affordable? And when there are multiple state governments already doing this practice of distributing free medicine in the public healthcare system, what do you think? What is the need of this scheme? Instead,
I think,
is there a better alternate to collaborate with the state governments?
No, this is absolutely correct. I think you have, Saksham, what you have said is exactly correct. You have struck your hammer on the nail. You're very correct. And in fact, Tamil Nadu has already done it, and they are doing it since 1993. One of the most successful, free medicine availability in the whole world, and we should all be very proud of it. And this is something which we need to take a page from Tamil Nadu. I have been very closely following Tamil Nadu Medical Service Center for the last 15 years. I have visited their place, and it's something simply exemplary and wonderful work. And subsequently, Kerala has done it, and so also Rajasthan has done it. And we are in Karnataka trying to pressurize our government to see that the free medicine availability is made available at all public hospitals. No person who goes to any government outlet should get a prescription from outside. All the medicines should be made available at the government hospital only. And what has happened, unfortunately, in Karnataka is that many generic medicine outlets have been started within the campus of the district and taluka hospitals and medical colleges. This is absolutely wrong. They should all be removed from there.
According to government records, as on 31st March this year, there are 9,303 Jan Aushadhi centers across the country. As per government data, during the financial year 2021-2022, PMBJP has achieved sales of Rs 893.56 crores at MRP. In the current financial year, that is 2022 to 2023, till 15th of February 2023, Pharmaceuticals and Medical Devices Bureau of India, PMBI, the implementing agency of PMBJP, has made sales of more than rupees 1,000 crores. Experts say that it is time the government uses the profits from these centers to completely revamp the scheme and root out corruption.
I saw their financial report of 21-22, and what I found, they're making a profit of 100 crores. Why not spend the money in encouraging or bringing policy where the pharmacists who pass out from college, they don't look for jobs, but they look for self-employment by setting up these Jan Aushadhi stores all over the country, in every block of the country, as a profitable venture. We have to ensure that they get a minimum return on their investment. If they take loan from the bank, they should be able to pay back the loan with the interest and still make profit. So we have to understand that. So government has to support this scheme in a very big manner. Rather than making profit of 100 crores, they should spend that money on building awareness. My suggestion is the procurement process of the Jan Aushadhi should become very robust. I had been suggesting to them that all procurement done by Jan Aushadhi should have a tracing and tracking mechanism. Technology is a very big enabler. So if any time any batch is found to be substandard, when they get tested, on a random basis, because they are testing randomly on the batches, and if they find that something is not of quality or is unsafe, is spurious, then it should be immediately recalled from the market before it reaches the consumer.
The Jan Aushadhi scheme's implementation issues and corruption have hindered its effectiveness in providing quality healthcare to the masses. The government needs to urgently address the supply chain, medicine availability, transparency, and awareness gaps. Without immediate reforms, the scheme's promise of affordable healthcare for all remains unfulfilled, leaving the most marginalised population vulnerable to a perpetual cycle of financial burden and compromised health outcomes.